Hey everyone, me Kevin here. In this video, we are going to break down Joe Biden's complete economic, stimulus, and COVID plan. This took a while to put together because he's got a pretty dang long plan, but what I did is I put this all onto a very easy to read concept map, so we are going to go through this together very, very simply. Let's go ahead and zoom in, get right into it. Right after I mention that, of course, you should still get life insurance in as little as 5 minutes. You can get life insurance during a pandemic, and Apple Pay and Android Pay for it. It's a great link down below, and get 3 free stocks with Webull. Deposit $100, get 3 free stocks with Webull. Okay, let's get started. So first, we'll get into stimulus as well in this, which there's a lot about stimulus in here. Very interesting and creative concepts on stimulus. We'll talk about those. But let's get started with testing. So first, Biden is a proponent of free testing. Anyone who needs it gets it. Does not matter what your immigration status is. And this will also reverse a Trump-era rule, which discourages, quote, all immigrants from seeking healthcare services for COVID-19. Now, some of this Donald Trump-era public charge rule, which kind of banned people from being able to receive benefits if they were immigrants or wanting to get a visa or green card. Some of that has already been overturned by a judge, but I think this would be sort of the final nail in the coffin. The CDC would prioritize testing. They'd also create and institute at least 10 mobile testing sites and drive-through sites through federal sort of guidance in every single state, and then they would expand from there. They'd start by putting these in cities. So basically, whatever testing we have in cities now, they would just add much more testing is sort of the goal. See, the Biden's administration's plan is that testing should be in the multi-millions, not in the thousands. Currently, testing, by the way, I looked it up, it's around 1.3 million tests per day. Sometimes that fluctuates between 1.1 and 1.4. Seems to be balanced around 1.3 million per day. This is up from 900,000 to a million per day in the summer. Although COVID cases have certainly skyrocketed much more than this 30 to 40% increase in testing we've seen here. On treatments, no costs or reduced costs rather for preventative care, and no copay or deductible for COVID-related treatments, no more surprise billing. We hear those horror stories of people going to the hospital and coming out with like a $10,000 COVID bill for going to the hospital for having COVID. Obviously, they'd push funding into the final development and distribution, I should say here, the deployment, that's right, deployment of a vaccine. PPP, they want to utilize United States manufacturing via the Defense Production Act to maximize the amount of personnel protective equipment we have, like N95 respirators, gowns, face shields, masks, for obviously our first responders. Right now, most hospitals have their N95 respirators under lock and key, and a lot of staff members are having to reuse masks over and over and over again. And especially the N95s, which are not oil resistant, over time they sort of break down. They become less effective over time. So Biden would have a huge push into more PPE funding. OSHA protections. Biden's plan would include stricter guidelines to protect workers from COVID, which I think that goes hand in hand with better PPE, but also a notification system for first responders and firefighters if they've been exposed to an individual with COVID. This now I thought was actually pretty interesting because I've done ride-alongs before with many ride-alongs with police and ride-alongs with firefighters as well. And one of the things is usually when you deal with somebody you would run into as a firefighter or paramedic or police officer, you don't necessarily know what happened to that person after you drop them off at, say, the hospital or wherever. And so some kind of notification system, I could see that being pretty useful. So that way, if a first responder, like a firefighter, carries a COVID patient to the hospital, and then they find out, oh no, they had COVID, at least they could potentially quarantine from their family if they needed to, if they weren't wearing the proper PPE. All right, now let's get on to some of the economic parts and stimulus relief. On the economy, Biden has a big plan to help fund state and local governments directly with federal support, and also wants to push renewable energy support. So I expect this will be good for EV manufacturers, certainly, maybe even the hydrogen field. But a big thing for right now is that 45% of funding would go to local governments, 45% would go to state governments, and 10% would go to hotspots, and this would be for medical supplies and infrastructure, including building and renovating existing hospitals. Expanded hiring for teachers, childcare, drivers, caregivers, first responders, overtime reimbursements to workers or other essential workers. We would also see a large push into paid leave. Biden's plan would provide emergency paid leave to all of those affected by the outbreak. Now, usually the way paid leave would work in a situation like this is if you are sick or you're taking care of somebody who is sick, you would be eligible. There are a few ideas for this, but Biden's plan does give us some minimums. Let's go through a couple of the ideas first. The first is following the Family Act, which the Family Act provides permanent 12 weeks of paid leave for serious health conditions, which would include childbirth or pregnancy. So this is kind of a push towards, kind of this direction that we see in other countries where when you give birth, you get 12 weeks off from work. So this would be available to also help care for somebody else. So you'd be eligible to take up to 12 weeks of paid leave to help somebody else in your household who is sick, to provide them caregiving support. And this plan, the Family Act, would be funded through a fee on each paycheck to sort of pay into a paid leave fund. And then pay would be 66% of your wage based on the highest annual wages that you've received over the last 3 years, with a minimum of $580 with a maximum of $4,000 per month. That's the Family Act. That's just one potential idea. The other idea is a Healthy Families Act, and this would provide 7 days of paid leave for family or personal health reasons. And it would obviously provide leave if you are sick from COVID to allow you to recover from COVID. Now, Biden wants at a minimum, because these are just two suggestions. So this is a bill and this is a bill. Those are suggestions, like, hey, here are some ideas. And usually these ideas get developed further or revised further once they actually get negotiated. But at a bare minimum, Joe Biden is looking for 100%, which you could already see some difference here from like the Family Act where we're at 66%. But Joe Biden wants at minimum 100% of weekly salaries, capped at $1,400 per week. So you kind of see a little slight modifications, but these are the minimums here. So a max of $1,400 per week, which works out to $72,800 on an annualized basis. 100% up to that figure. Biden wants this to be 100% federally funded. Doesn't mention, though, how or where that money would come from, but the Biden plan does say that the Family Act has really good ideas, and the Family Act does say that there would be a fee added to each paycheck. So obviously, the more money the government provides, generally the more taxes tend to go up. Obviously, sick workers would be covered. Those caring for sick people would be covered. If you're unable to work because you are at risk of getting COVID, like you're a high-risk person, you'd be eligible for coverage. Childcare, if schools are closed, there would be childcare payments made. Paid leave for gig workers, independent contractors, and caregivers. Biden's plan does really specifically talk about making sure that gig workers and self-employed workers are treated like regular employees as well and are eligible for these benefits like paid leave. Government to reimburse employers for 14 days of paid leave above and beyond the existing leave policies. Direct payments to go to workers where needed due to work arrangements. So the federal government would establish some sort of system for actually providing direct funding of paid leave when necessary. It does say here that, quote, Biden's plan will provide all necessary funding to ensure that paid leave will be available immediately. One potential option for workers who require direct paid sick leave payments will be to staff up existing Social Security admin offices to assist with the distribution of emergency paid leave funding. So in other words, it kind of like where you would go to get your Social Security benefits or where you go to get your Social Security card replaced, you'd go there almost kind of like it would turn into like an unemployment office, and you'd get your paid leave payments through there. And again, these are just ideas right now, but you can see what some of the priorities are. So then we'll get into unemployment stimulus and other stimulus benefits. So on unemployment, supporting unemployment offices, so basically more funding to modernize unemployment offices. I think we all know this is pretty well needed. Relaxing work history and waiting requirements or looking for work rules. Prevent workers from being denied benefits because they lost work through no fault of their own, but are ineligible due to some of the unemployment rules that exist. Partial unemployment to those with reduced hours. This is a big thing. You know, a lot of people, maybe, they could be bakers, they could be working in casinos. A lot of people used to work full time. They worked 40 hours. Sometimes they had overtime. They worked 40 hours a week. Now they're working 20 hours a week because demand just isn't there at certain businesses. And so partial unemployment benefits would go to those recipients. We had some of that with the CARES Act, and so more of that would be expanded. And as well, on 12/31 of this year, we will see an expiration for unemployment eligibility for gig workers and caregivers and independent contractors. Biden wants to see that extended so that, again, they are treated as normal employees. More funding for the SNAP and food stamp program, broadened relief for food banks and more support for food banks, which, remember, the summer food program is still available. It's all the way at the bottom of the description. You'll see a phone number that you can call. If you want SNAP, you call 211. But if you are 18 or younger or have a child who's 18 or younger, remember, you can take advantage of free food through the end of the year, all the way at the bottom to find out where. Now, new small and medium business loan facility. This is really interesting. We haven't seen something like this before just yet. Interest-free loans. So this is different from the PPP. You'd have to pay this back. It's also different from the existing SBA loans, which are not interest-free and you have to pay them back. This would be for small and medium businesses to actually, through the duration of the crisis, get funding, get loans. One of the things that's been very frustrating for businesses now is it's difficult to get loans. Credit is tight, so you might need a loan to get by as your business just to float through the next 6 to 8 months until we get more mass inoculation via vaccine. But like, for example, you look at the Main Street lending program, it's a total failure because it basically is only available to companies with high cash flow. Well, companies that are suffering right now who need the money the most don't have high cash flow. Very frustrating. More funding for schools. Forbearance. Here we go. Mortgage forbearance and student loan forbearance until the crisis is over. That's good. We do have mortgage forbearance until 3 months after the pandemic. The national emergency is technically over. So we do already have that, but we do not have the student loan support. So student loan support currently ends at the end of the year. Rental relief, folks, this is a big one. The Fed to partner with estates, not Tate, to provide rental relief so that no one faces evictions due to the impacts of the COVID-19 crisis. Really, really good. I'd like to see that. Rental relief is something we desperately need because, again, we have another cliff coming up on 12/31 here, so we can see quite a few cliffs we've got coming up. So stimulus checks via governors. This is really interesting. Authorize governors, where necessary or where they determine it's necessary, to directly, a couple typos here, sorry about that. I wrote this all over, wanted to make this a nice summary, to directly draw on federal funding to implement a progressive cash or tax relief program, which could include cash payments to working families, unpaid caregivers, and seniors, as well as those with disabilities, children, or a child allowance. So basically, there would be some sort of pot that every state could draw from, and they one state could say, hey, we're going to give tax breaks. One state could say, we're just going to give stimulus checks. One state could say, we're going to give money to children. We're going to give money, child allowances. So it really gives these state governors the power to issue essentially these stimulus checks. They're sort of this direct relief, either through tax credits or just providing money straight out. We would rejoin the World Health Organization. Hospital capacity, immediately deploy the federal medical station field hospitals where needed, multi-hundred bed facilities, activate the Medical Reserve Corps. I'm pretty sure they've already been actively at work, but this is a group of 200,000 medical volunteers to help with surge capacity. I know they've already been working on things like contact tracing, testing, and counseling, so maybe there'd be sort of this additional activation of them. Telehealth, this was really interesting to me. Surge, tele-emergency room, and tele-ICU care, and telemedicine. I mean, telemedicine I get, but emergency room and ICU care, I mean, hey, I think that's probably a good thing. I mean, I've always thought to myself, like, you should be able to, like, FaceTime 911 and go, hey, someone's choking, what do I do? And they, be able to walk you through it. I mean, I don't know, I'm guessing here. Obviously, being able to dial 911, have somebody come really fast would be nice too. But not sure what that entails, but it seems very interesting. Prep for future pandemics, more biomedical research, more rapid testing, more disease surveillance. especially in nursing homes to track diseases in nursing homes. Permanent public health and responder system, so really expand and get better for future pandemics to be more prepared. That also relates, by the way, to this right here, which is restoring the White House National Security Council Directorate for Global Health Security and Biodefense. Could you imagine having that job title? Oh yeah, I'm the Assistant Vice President of the White House National Security Council Director for Global Health Security and Biodefense. Jeez, trying to fit that on a name tag. Anyway, this group was eliminated by Donald Trump. This was an Obama-era group, and this would be reinstituted. Biden is a big proponent of communication, says communication is essential to combating the dangerous epidemic of fear, chaos, and stigmatization that can overtake communities faster than the virus. Some other quotes here. Heed the calls of House Speaker Nancy Pelosi and Senate Democrat leader Chuck Schumer. It says that if Trump does not take these actions, Biden will on day one. This right here is very big, this one right here about the Speaker Pelosi and Chuck Schumer, because remember what they want. They want the HEROES Act. They want $2.4 trillion. So really what you have here is Joe Biden saying, look, we need to do as Nancy Pelosi and Chuck Schumer say, we need to push through a large stimulus package, the HEROES Act, which we already know the HEROES Act is loaded up with $1,200 stimulus checks to the same people who got them last time, $500 for dependents. We've got rental relief in there. We've got mortgage forbearance modifications in there. We've got relief for tenants in there. We've got relief for the airlines, relief for restaurants, business funding, EIDL funding, SBA funding. I mean, there is a lot of money in this particular HEROES Act. So it does look like Biden would be in full support of that HEROES Act. So this kind of gives us a full breakdown and overview of what Joe Biden's stimulus, economic, and COVID relief plan is. If you found this helpful, consider sharing this. Also, make sure to get your 3 free stocks with Webull, get your life insurance, and check out the great programs down below to learn how you can build your wealth. Thanks so much for watching, and we'll see you next time.